Georgine, would you please tell us a little bit about yourself?
Sure. My name's Georgine Nanos. I'm a family physician. I have been practicing medicine in Encinitas for 18 years. I also have advanced training, besides my medical degree, I also have advanced training in epidemiology and public health, which is the study of how diseases are spread. So I've been speaking out a lot about the coronavirus and COVID-19 and trying to provide a lot of information to the public as much as I can during this time.
Yeah, well, and I appreciate you coming on. We're just kind of basically trying to inform the public, I sell real estate, and it's been a different world now in regards to that. People are still making moves, but I wanted to kind of give, some word from the boots on the ground that basically, I guess you could say, that are doing it. Now, my question is, what do you think the biggest myth that's circulating about the virus right now?
I think there's so many of them right now, but I think the perception that people have that it's not as serious as the media is portraying it to me portraying it to us may be probably the biggest myth. It is a serious problem that we all need to take seriously at the same time, and that's the key. Is if we're not all taking that personal responsibility to maintain our physical distance, wash our hands, and do what we're supposed to be doing, if we're doing that in a piecemeal approach, then this is going to take a very long time to solve.
Mm-hmm. Yeah. So what are the three most important things for people to do to stay safe? What would you suggest?
Well, first and foremost is to wash your hands. I mean, it seems very simple. We've been saying this from the beginning, but hand washing is our number one defense against this virus. As simple as they may be, it is the key. And physical distancing, staying at least 6 feet apart if you need to come in contact with anybody, but then also to stay at home and really take that stay-at-home order seriously. We've had that in California. For a while, we were one of the first states to have that stay-at-home order, and I think that's really helped California keep their numbers very low compared to some other states. It also helps that we're more geographically spread apart than other cities, but I think that's helped us quite a bit, and we need to continue to take that seriously.
Yeah, and do you believe that masks are needed to not spread it on breathing on people?
Well, the mask thing is, I know this became a new order this past week and over the weekend. I think the important thing is to first stay at home, so you don't need to be out in public very much, in which case you wouldn't need a mask to begin with. But we need to reserve the medical grade masks. Any masks that should be used in a hospital or clinical setting should be reserved for healthcare workers, because healthcare workers just simply cannot do their jobs if they don't have the right protection. And that, if they can't do their jobs, then we have a way bigger problem on our hands. Yeah. So if people want to make at-home masks, I think that's perfectly fine. It can't hurt. The only thing we worry about is if you're really fixated on your mask and you're constantly touching your hands to your face with your mask, then, you've defeated the whole purpose of having the mask. So it's possibly going to help a little bit, but again, we need to focus on the bigger picture, which is staying home, really washing hands, avoiding people and situations where you could be exposed. I mean, here in San Diego, we're not in crowded mass transit situations like you have in other parts of the country. I think the likelihood that it's going to have a big impact here is going to be low. Maybe in higher density environments like New York, it'll be helpful, but here I don't see it having a big impact.
Yeah. And you said that definitely this is pretty serious or very serious. Do you think that the media has blown this probably a little out of proportion in regards to body bags and all the other things that they're talking about in New York to scare people?
Well, I think New York's in a very different situation than what we're in here. And it's very hard to predict what the reality is going to look like in the end. It is going to be different in different parts of the country. And it will, I think New York and the Northeast is in for a much bigger blow from this than we are.
Right.
But we just, all of our actions right now, today, in the next 30 days are going to really define what this ultimately looks like. And if in the end it's much lower than we expected it to be, then that's a good thing. To underreact is the horrible outcome. So at this point, I'll take the overreaction rather than having, a massive death toll and say, look back and say, God, I wish we could have done more.
Right. Do you think the massive death toll would be from the people that actually got the COVID-19, or do you think it would be from the people that may need, that are dealing with other underlying symptoms that, need the attention to the hospital beds or to the ventilators?
I think it's potentially both. And the longer this goes on, the higher that number is going to get for exactly that reason. As people have urgent and semi-urgent medical needs that can't be addressed, then that's going to get worse over time. So for sure, that's part of the equation as well. I want to remind everybody that 70 to 80% of people who get COVID-19 are going to recover just fine and not have any complications from it. And then of the remaining 20 to 30%, most of those people will also recover, but may have some complications. And then a very, very small percentage will actually die from this disease. But nevertheless, those are, in that time period in that space of the 20 to 30%, that's scary for those people and their families, obviously.
Definitely. Well, any death as well, that's
right.
One of the things that people are dying, and they do die every day. We could take a look at the numbers on the stats of different diseases that are killing more people than this. But we were talking about the numbers and the ages, and then the recovery rate. So it looks like it's a pretty high recovery rate, though, from the COVID-19, right?
Yes, exactly.
Cool. What do you see? We're seeing videos about unloading groceries, and is that really necessary? And also talking about the mail as well.
Yeah, I think that's a little bit of an extreme overreaction, I would say. Most of we're still learning more about the virus every day, and our knowledge about it is evolving daily, but by the minute, really. But most of your transmission is going to be from person to person contact, not person to mail to person or grocery to person. So the likelihood of you contracting it from that way is very, very slim. It's obviously a good idea to not if you're coming home from the grocery store and you've got a bunch of groceries, you'd probably want to maybe rinse off a little the bags that the handler put them in, or some products that you can leave out, maybe let them sit for a while before you put them away. And you should always wash your fruits and vegetables with cold water. I wouldn't put soap on your vegetables. That's just not something we've ever recommended. So I think it's a lot of overkill that stresses people out and brings more anxiety to an already anxious situation.
Right.
So we have to remember it's our own hands touching our face. That's how this is going to happen. And you're not going to get the disease through your hands. So for example, the virus doesn't go from what you touch directly into your hand, into your body. It's the moment from when your hand, having something contaminated on it, touches your eyes, nose, and mouth. And that's where the transmission occurs. So continuing to wash our hands, continuing to be cautious about touching our faces is really where it's at, and not making yourself completely crazy in the process. It's true, though. I mean, that it's a big deal. People are really struggling.
And I get it. Well, and I would say probably the biggest thing, this is just me, but they keep turning on the news, and when you see deaths and highlighted in red and scrolling on the bottom, body bags and things like that, I feel, and I think the media has blown this out of extreme proportion, and the ratings are up, and that's my thought. So yeah, and they're scaring the crap out of people. I saw stats, 2.1 billion mentions in the media regarding this, and I think the highest one was the N1H1. When that came out, there was 65 million mentions, but now 2.1 billion already.
Yeah, it's definitely creating a lot of hysteria, and that's a secondary problem, I believe, that also needs to be addressed. The measures that we're taking are necessary, but they are also creating a lot of stress for a lot of people. People who already have underlying anxiety, depression, addiction issues, they're struggling a lot more during this time of isolation. It's really tough for people. So, I would recommend getting in touch with your healthcare provider, whether it's your mental health care provider or physical health care provider. And a lot of primary care, like our group, we do mental health and physical health, and doing a virtual visit with them. It's super easy to do. And we just started taking new patients just for this very purpose. And it's just, you just need to connect. And I've been calling it physical distancing instead of social distancing for a while now, because you want to stay connected socially to your network, because that's what's going to sustain you during this hard time. It's really the physical distance you want to maintain.
Physical distancing, that is so true. Yeah, that's a great one. Thank you so much for that. Now, with that said, I was listening to another one with PragerU, and he was talking about the people that are getting hit the hardest are grandma and grandpa. The people that are not able to go to AA meetings, people that may already have depression. What are some of the things that, and I think you just touched on a couple, but what are some of the things that they could do like right now to make them feel a little bit more at ease?
So again, it's I think all of us taking a moment to think outside of ourselves and our own needs, and reach out to people in our community, our family, our loved ones, our neighbors, who may be struggling, and just connect with them, give them a call, do a FaceTime visit with them. Just say hi. It can be 30 seconds. Ask them if they need someone to go to the grocery store for them. Anything like that would be helpful at this point. And then AA meetings are all online now, and NA meetings. So you can find those if you Google your local AA chapter, they can direct you to some online meetings. I have a lot of patients who are doing those with very good success. We also do health coaching and nutritional counseling and wellness counseling, and some mental health counseling as well, through our telehealth services at Kind Health Group. And so we can help you with that as well.
Oh, that's great. Thank you so much for that. So what can we do to support those people that are on the front lines right now in the healthcare, the nurses, the doctors that are at the hospitals right now? What is the public? What can we do to help them?
I think to stay home and donate any of your hoarded supplies back to them.
Would that be the toilet paper that my neighbor grabbed 14 boxes
Sure.
of?
Yes. But if you have masks, gloves, hand sanitizer, gowns, goggles, anything like that, that's what they all need right now. And just using common sense and being thoughtful of others is really key right now, and making sure that we're working together as a community. I think I've seen that more and more. I mean, I haven't been out to the grocery store very much, but I think there is more of a sense of community out there now than there ever has been. And I just hope it lasts through all this.
Right. That's a big one. So what can we do if, say, one of our family members contracts the disease? What would be probably the best thing that you would recommend for them dealing with it? And honestly, I don't know of anybody that's got it. I knew that I had it in January, at least coming back from an international cruise. I never got tested, but I everything that they speak of I had. But nevertheless, if someone gets it, I mean, what should the rest of the family do?
Well, I think I had it in January too. I think a lot of people feel like they had this weird early January bug, and so it's very possible. The thing is, for anyone who has mild disease, or even, and that's part of the issue too, a lot of people are having what we call asymptomatic or disease, which is where they show almost no symptoms at all, and maybe just feeling a little blah. Then the key is really to just stay home. And that's the whole reason these stay-at-home orders are in place, is really to assume pretty much that everybody has it, and
right.
that you're staying home for that, duration of the quarantine. If you test positive or you become really sick, then, try to find a room in your house where you can isolate yourself and maybe just have one caregiver in the house take care of you so as not to additionally expose everyone else in your family. Although realistically, it's very likely that if one person in your family household has it, it's likely the rest will get it too. But on the off chance that hasn't happened yet, you want to just limit that spread to, potentially one other person. And in that case, yes, that person should be wearing masks and gloves, and you should be wearing a mask when you come in contact with your other family members if you're infected. So the key is if you don't have shortness of breath or severe disease or underlying conditions that could be potentially life-threatening, then we want you to stay at home and try to manage your best at home.
And
Or,
go ahead.
Yeah. Or you can also do a virtual medicine visit, telehealth medicine visit with your doctor, and they can help you through that as well, which is something we've been doing all week as well.
Perfect. Now, can you break the myth in regards to saying I had it in January? Can I get it again?
I can't, because we don't have enough testing to determine that for sure. So there's a lot of testing companies that keep saying they're going to come out with this test that will tell you if you have antibodies, but there's only a few of them that have recently gotten FDA approval, and even fewer that are actually on the market like today. So I think next week we're going to see a rollout of some more of those tests, and I think we might have access to those. So the key is, right now the test that exists is called a PCR, polymerase chain reaction test, and it's swabbed up through the nose, and we send it to a lab outside of the state, and it's got like it used to be a 3 to 5 day turnaround, but now they're so backlogged, it's like 10 to 14 days to get the test back. And that test only tells you if you're currently infected. It doesn't tell you if you were infected in the past. And so that's part of the issue. So now we're looking at these they're called rapid point of care tests that look at two things. They tell you instantly, they actually do a finger stick through the blood. They test your blood, and they tell you if you're infected right now and if you've been infected in the past. They can't tell you when in the past, but they'll say like, you have an antibody, this has been in your system in the past, and they'll give you that information. And then and it may be that I haven't seen it yet, so we'll see what that looks like. But I would like to take one of those when we get it.
Yeah.
Confirm my January theory.
Yeah. Well, we'll see here. Now, I had some stats here from the diseases, and this is something, I'm just saying that diseases per day that kill people. I mean, we're in COVID, I think, here when this just came out in March. I mean, there was only 56 Corona COVID deaths at the time, but 3,000 per day happened with tuberculosis, hepatitis B, 2,300, 2,200 with pneumonia, HIVs, 21, et cetera, et cetera. I mean, do you think, and I'm hearing that we're going to peak in America here in the next 6 to 7 days. What are your thoughts on how many people are actually going to pass from this? Do you have any idea from the stats you're seeing or anything?
Again, those are models based on projections and best educated guesses. And again, what we're doing right now as a country is what's going to hopefully reduce those numbers. And to your point, yes, there are diseases that many more people die of every day. Heart disease, for example, is one of them. About, I think it's 1,700 people a day die from heart disease or something like that. And it's important to keep that in perspective too, but and there's lots of things we can do about heart disease. We can do a different episode on that.
Well,
that's totally
diet,
just a diet. That's a completely separate episode. Yeah. But staying healthy, and I mean, that's also part of the issue here in this country. A lot of us have unhealthy lifestyles and a lot of chronic disease, a lot of obesity, a lot of diabetes that people don't even know they have. Right. And so I think because of that, as a generally unhealthy nation, we may have the potential to see a worse outcome for that reason alone. But the best thing you can do right now is to lead as healthy of a life as possible, to eat healthy, to get some exercise every day. Your health has never been more important. And instead of, when you have to go to the grocery store, instead of buying all the processed canned stuff that will last through anything, there's lots of fresh fruits and vegetables out there. Get those things. Make stuff that you can freeze, soups. There's all kinds of stuff you can make with fresh fruits and vegetables that you can freeze and save for later. And I think we have to remember that also.
Exactly. We were just listening to a doctor just recently here before the show and just talking about, you need to go to more plant-based, basically, if you want to live a long, healthy life and get off the fats and food.
Absolutely. That's what we preach every day.
Yeah. And more water, sleep.
Yes.
That's what they're saying, just to stay healthier, because they'll give you a chance for your immune system to fight off any viruses that come on. So anything you could say besides those things, any supplements or anything like that you recommend? Vitamin C, B12, D, maybe elderberry, anything like that, zinc?
No, there's not a lot of evidence that supplements are necessarily more beneficial than healthy whole foods. There's really no substitute for what's at the end of your fork. Supplements are not always that helpful, and a lot of them can do harm if you take them in excess. So I'm not a huge fan of supplements. I don't promote them unless you have a known deficiency. Now that we're not getting outside that much, maybe some vitamin D would be helpful, but really it's about eating healthy and eating the rainbow, eating as many different colored fruits and vegetables as you possibly can. That's where your healthy nutrients are really going to come from. And if you're doing that, you usually don't need any additional supplements.
Oh, that's great. Well, thank you for that. So to wrap it up, what would you share with the public, for the world, if you can get up and you're blasting this to the entire world in regards to what you're seeing and feeling and your professional knowledge to help people through this a very unprecedented time right now?
I would say that we have to keep it in perspective and remember that most of us are going to be fine. Even if we do contract the disease, or if our loved ones do, they're going to get through it. We need to remain calm. We need to stay connected to each other, and we need to wash our hands.
And don't touch our face.
And don't touch your face.
No, that's a good one. Well, thank you so much, Georgine. That is awesome. And if we want to get in touch with you, we'll have this information down below on how you can contact her in regards to your med spa as well, when we're able to have the unphysical distancing going on as well, right?
Yes. Well, right. We also have a very big primary care aspect to it. So if you feel like you need a medical visit, you can also go to kindhealthgroup.com and schedule a virtual medical appointment as well. So we do both.
Fantastic. Oh, that's great. Well, thank you so much, Georgine. We appreciate you. God bless you. May the force be with you and your family. Stay healthy.
Thank you, Carlos.
All right. Thank you.